Say thank you for being here. Good afternoon. Um, what happens when people care most about patients and are punished for trying to make things better? My name is Slayo Simmons. I stand before you not as a civil rights attorney, but as a community member and an advocate for justice, equity, and integrity in our public institutions. Today I'm here to deliver a very clear and urgent message on behalf of those whose voices have been silenced, sidelined, and ignored within a system that should serve all of us with dignity and respect. We are calling on the Hennepin County Board of Commissioners to launch an independent investigation into the workplace culture and personnel practices at Hennepin County Medical Center. Why? Because HCMC, a publicly funded hospital entrusted with caring for our most vulnerable, have strayed from its mission. The experiences shared with our office reveal a deeply troubling pattern. Employees who raise legitimate concerns are met with retaliation, not collaboration. Those who offer constructive dissent are pushed aside, excluded, or removed. And most concerning of all, women of color, already navigating systemic obstacles, are being disproportionately penalized for speaking out. We urge you, let me be clear. This is unacceptable. This is not an internal issue. It is a crisis of public trust. These aren't just policies. These are real people, real lives, real harm. And here's what they're saying. This is a quote from my office that we received. Hennepin County Healthcare is knowingly perpetuating a racist and exclusive work environment and not taking any substantial action to stop it, despite necessary tools to step forward and ensure my safety and well-being. Another direct quote, I wonder how many women of color will have to stand up before someone examines the abusive workplace practices and all the women of color that have been hurt to maintain others' positions. This comes at a time when we desperately need to work together. I strongly believe HCMC needs new leadership that actually listens and responds to people rather than attacking and undermining anyone they perceive as a threat. Another quote, as a current leader, I have witnessed and experienced patterns of harassment and institutional resistance when the individuals raise concerns tied to racial justice, safety, and accountability. This net cannot continue unchecked, end quote. That is why we are calling for a fully independent, transparent, and comprehensive investigation. At this time, you're going to hear the next remarks from the union that have joined me in this call for an independent, fully transparent investigation. You're going to hear from two individuals. After that, you'll hear from Nikima Levy, who's here with us to share excerpts from people that have responded to my office, and I'll give last concluding remarks. And Kandra Revering, thank you for letting me know that. First, you'll hear from Sarah Frank.
Thank you for being here today. My name is Sarah Frank. I serve as the president of AFSCME Local 2474, the union representing nearly 1,400 workers across 90 job classifications at Hennepin County Medical Center. Our members serve nearly every corner of the hospital, from medical assistants, physical therapists, surgical techs, mental health workers, protection officers, and beyond. We know this institution and we love this institution. And we are here today because we are deeply concerned about its future. We joined this press conference with our coalition partners out of both commitment and heartbreak. Over the years, we have watched slowly erosion of accountability, transparency, and respect for the people who do the work of healing. When HCMC was partially privatized in 2007, decision-making shifted from elected leaders who are accountable to the public to a small circle of executives who answer to no one but themselves. Since then, we've seen decisions driven more for power consolidation than community care. The result is a growing disconnect between executive leadership and the daily reality of frontline workers. Management decisions are too often made behind closed doors without the voices of those who know the system the best. And the consequences are real. Delayed or ignored workplace safety measures and workplace violence prevention, retaliatory and discriminatory disciplinary practices, failure to get the staff buy-in required to implement workable solutions in the care environment, and above all, miss opportunities to improve patient outcomes and support those doing the work. When we raise serious concerns rooted in experience and aimed at solutions, we are met with no collaboration, but with resistance, defensiveness, and silence. Management seems more interested in protecting its own image than making HCMC a stronger, safer, and more equitable place for patients and staff. We know that healthy institutions don't punish those who speak the truth or propose improvements. They honor them. They elevate frontline leadership, but HCMC, too often, for those who advocate for better care, particularly worker leaders, respected by peers and loved by patients, are marginalized and pushed out. They leave, and with them go the years of experience, wisdom, and dedication. This is not sustainable. Minnesota needs a more inclusive, transparent HCMC, one that nourishes the best in us, listens to those closest to the work, and recenters care, not control. The future of public health care in this state depends on what happens at HCMC. We have no doubt that HCMC workforce has the talent, strength, and the heart to meet this moment, but we cannot do it alone. What we need, and what we have needed for a long time, is accountability from those in charge. Sadly, the internal systems meant to address our concerns are broken. Repeated attempts to resolve issues through paper channels have gone nowhere. This is why we are turning to the public. We are asking the Hennepin County Commissioners and the HHS Board to do what executive leadership has failed to do: launch a fully independent investigation into workplace practices at HCMC. We urge the commissioners and the HHS board to act with courage. The people who care for this community deserve better, and the community deserves a hospital that lives up to its mission, not just in words, but in actions. Thank you, and I will introduce Kelly. She is a physical therapist.
Hello, my name is Kelly Rman. I'm standing here today as a physical therapist for Hennepin County Medical Center. I have a doctorate degree in physical therapy, and I've been a treating provider in this organization for the last 12 years. I am also an AFSCME Local 2474 steward. I'm speaking not only on behalf of myself, but for a team of highly trained and deeply committed professionals who have spent years trying to raise serious concerns about wound care practices that directly impact health and safety. For several years, there have been many physical therapists at HCMC that have consistently gone above and beyond to develop a very rare skill set and obtain advanced certifications in wound care. Extensive knowledge in wound care and skin management has allowed us as providers the ability to provide excellent care for every patient population that comes through the doors, regardless of their diagnosis. In the past, we have made repeated efforts in good faith to engage hospital leadership in dialogue regarding concerns with standard of care and the current gaps in wound care throughout this healthcare system. Our goal has been simple and consistent: to improve collaboration and care between departments and improve patient outcomes by providing evidence-based wound care within our scope of practice and in alignment with our professional and ethical obligations. However, instead of collaboration, we've been met with silence. Despite our professionalism, our passion, and our expertise, and our clear commitment to HCMC's mission, our attempts to propose practical, patient-centered solutions have been repeatedly dismissed. When our team compiled a list of patient cases to illustrate systemic gaps in wound care, a step that we hoped would encourage constructive engagement, we were not met with gratitude. Instead, we were punished. Leadership responded not with support, but by suddenly prohibiting our highly skilled therapists from providing wound care altogether and launching retaliatory investigations into our team. The message we received was clear: speaking up for patient safety comes at a cost. Even more troubling, a medical provider that holds a position in leadership reportedly used the hospital's event reporting system in a way that appeared to be less about transparency and more about intimidation. This action created an inappropriate power dynamic that resulted in general sense of fear and anxiety while treating our patients with even the most basic PT interventions. When AFSCME followed internal procedures to report this behavior, the complaints were quietly stalled. This demonstrates yet another example in a growing pattern of inaction and avoidance when serious concerns are raised. Instead of taking action against retaliation, our team was simply told we needed to improve our communication skills. So, in the spirit of direct communication, let me be clear. HCMC is a public institution. It does not belong to a handful of executives. It belongs to the people.
That's right. Good, Kelly.
Our patients, our workers, and the broader community who depend on this hospital to provide excellent care. Our mission clearly states exceptional care without exception. The expectation is a system that values excellence, teamwork, respect, and integrity. The physical therapists who spoke up should be celebrated for their courage and integrity, not punished for doing the right thing. What has happened here is not only unjust, it is negligent and creates a very high risk for our patients' safety. We are calling for a full, independent investigation into the workplace practices at HCMC. That includes not only retaliation and suppression of staff voices, but also the systemic failures that are putting patients at risk. It's time to build a culture of transparency, collaboration, accountability, and shared responsibility. One that prioritizes patient care, supports clinical expertise, and respects the voices of those on the front line. Thank you.
Thank you, Kelly.
Good afternoon. My name is Nikima Levy Armstrong. I am a civil rights attorney as well as the founder of the Racial Justice Network. I'm here standing in solidarity with employees of HCMC who have had enough. We are hopeful that the Hennepin County Board will take accountability for what is happening and follow through on Attorney Slayo Simmons' call for an independent third-party investigation into these very alarming issues that not only harm employees of HCMC, but also their patients, many of whom are people of color who hail right from this community and who deserve excellence. Excuse me. So as part of my role here today, I am going to read an excerpt from a statement of an employee. And the reason that I am reading this statement is because of this history of retaliation that employees of HCMC have experienced when they have brought forward concerns. So this employee wishes to remain anonymous, so I will be their voice today. I'm writing to formally file a complaint regarding workplace retaliation, discrimination, and unfair job opportunities that I've experienced as an employee of Hennepin Healthcare. These issues have significantly impacted my professional growth and created a hostile work environment within the Health Equity Department under current leadership. As a Black leader within this institution, I have faced persistent micromanagement, undermining of my authority, and diminishing of my worth. I have observed patterns of anti-Blackness and systemic oppression that have limited my opportunities for growth and fair treatment within the organization. Despite my qualifications and contributions, I have been subjected to discriminatory treatment that has hindered my ability to advance and succeed in my role. This anti-Blackness manifests in exclusion from decision-making processes, lack of access to the same opportunities, and a general devaluation of my professional contributions. Additionally, after raising concerns about these inequities with HR leadership and the CEO, I experienced retaliation in various forms, including unfair disciplinary actions, reassignment to another leader, increased scrutiny, exclusion from merit increases, and a general pattern of oppressive behavior that has negatively affected my well-being. The culmination of these experiences even led me to take several mental health days as a direct result of the hostile work environment. What is particularly troubling is that my experience is not an isolated incident. There are clear patterns of discriminatory behavior within the Health Equity Department, with other Black employees and professionals of color reporting similar treatment. These patterns align with broader issues of workplace bullying, as seen through constant criticism, undermining of work, micromanagement, rumor spreading, silent treatment, verbal abuse, manipulation of performance reviews, and setting employees up for failure. These tactics create a toxic culture that discourages Black professionals from thriving and contributes to a workplace climate of fear and exclusion. Thank you.
My name is Kandra Revering. I am co-counsel along with Slayo Simmons. I am also a supporter and advocate of these employees, as well as a minister of justice. I'm going to read to you a statement from another employee who remains anonymous, but this statement also supports the dire need for a workplace investigation. On July 31st, 2023, the Interpreter Services Department transitioned under the Division of Health Equity at Hennepin Healthcare. As a long-standing leader in language access operations, I welcome this move with optimism, believing it would elevate our work and better support patients with limited English proficiency and those who are deaf and hard of hearing. However, in the fall of 2024, after identifying inefficiencies and raising concerns about the negative financial impact on our department's budget, I shared operational data and proposed strategic solutions to protect both service equity and financial sustainability. Despite my efforts to bring clarity and offer viable, responsible solutions, my concerns and professional expertise were disregarded by health equity leadership. Rather than engaging in a collaborative discussion, leadership dismissed data-driven recommendations I provided, recommendations aligned with institutional accountability and quality care. When I escalated these concerns to the CEO, Jennifer D. Cubelis, I experienced a pattern of harassment and retaliation. Thank you.
So as we conclude, I want to be clear. There are many more that out of fear, they could not join us, but they stand here today with us, from the sidelines to in the building, from right behind us. So we're thankful for those who could stand with us. We're thankful for those who spoke, for those who were too in fear to speak for themselves. On May 9th, our office wrote a letter to the Hennepin County Board of Commissioners, simply asking for a full third-party investigation into the work practice at HCMC. That was met with silence. So that is why we are here today. So let me be clear. To the Hennepin County Board of Commissioners, we are looking to you for bold leadership and swift action. The investigation that we're asking for is not only a legal imperative, it is a moral one. The public is watching, the workforce is waiting, and history will remember how you respond. And to HCMC's leadership and to their board, we urge you to reflect deeply. The time has come for course correction, one that centers on justice over control, equity over hierarchy, healing over harm. Across the country, public institutions are being asked to live up to their values, not just in statements, but in action. HCMC is no exception. And here in one of the most diverse counties in the state, the stakes could not be higher. We're here not just to call out injustice, we're here to call forth a better future, one where care, not control, is the foundation of this hospital's culture. Because no one should be punished for doing the right thing. No, not in our hospitals, not in our communities, and especially not in Hennepin County. Thank you so much for being here. We'll take 1 to 2 questions, and then we're going to let these good folks get back to serving its residents. Are there any questions? I see a couple people here from press. Any questions? If not, y'all, we appreciate you being here. Thanks so much. Thank you so much.
Yeah, I'm curious if you can, I know people would like to remain anonymous who are speaking with this. Can you give any more specific examples of what this looks like and what retaliation looks like for those employees?
Is there anyone who would like to speak to that? Examples of retaliation?
Nathan, who's from the union, would like to address that question.
I can give a quick example. You know, a few years ago,
Do you mind saying your full name?
yeah, it's Nathan Pollson,
Thank you.
What's your job title?
and I'm a mental health worker in inpatient psychiatry. I've been here for about 15 years. You know, a few years ago, we organized around excessive use of seclusion and restraint. One of the doctors participating was on the restraint committee at the time, and for his participation was summarily demoted from the restraint committee. I have a lot of other examples. I don't want to share them right now in front of everybody with cameras rolling, but I will talk about them. I just want to make sure I get right if I'm talking about other people's stories. But there are plenty. I have many. Okay.
Thank you, Nathan.
Thank you. Thank
Does
you.
anyone else have an example of retaliation that you're aware of? It doesn't have to be your story, but something that you know in terms of the culture.
Kim?
Yes. I'm Kim, medical assistant. I'm the chief steward here. I have a lot of retaliations against some of the investigatory meetings that I have. I'm with Nate. I'd rather discuss it later at a later time. But there is a lot where people have been fired and also disciplined harshly. And it has not been recognized to what's going on right now with human resources. They pretty much would do different things with different people. If they're white, they get treated more fairly. If you're black or Hispanic, you get treated harshly. And it's ended up in resulting in retaliation of people just quitting. So I would discuss that at a later time.
All right. Thank you all. We appreciate you.
one more.
Eco, please. Yes, Eco.
Can I
Yeah.
ask
My apologies.
when
Thank
this
you,
all
Nikima.
started, like when you all started noticing this, if you don't mind adding it?
Oh, it's been a long time.
It's been years is what I'm hearing in the background. This has been in the making for a very long time. I would love for you all to hear from Eco.
Hi, my name is Eiko Mizushima.
Hold just a
Yes,
little bit
yes. Hi, my name is Eiko Mizushima, and I was pushed out of working here at HCMC. I was the previous executive chair of the Asian Collective, and I ended up leaving in October because of the harassment, discrimination, and retaliation that we were experiencing. In particular, what I found really difficult near the end was that I had filed a report with HR reporting harassment and discrimination from someone who was part of the executive leadership team. And turns out if you report harassment and discrimination from someone who's on the executive leadership team, that all their friends who are on the executive leadership team don't want to look closely at that. So it was ignored. And then there was a retaliatory HR reported against me for sending an email that said that I experienced harassment and discrimination. And it didn't go anywhere. And I did report it to the county commissioners, and nothing happened.
Thank you for
Thank
sharing,
you
Eco.
for your courage.
Thank you.
Anyone else?
Would anyone else like to give a specific example?
I mean,
Nikima?
I will just add that I also got myself a written reprimand as I was stewarding a restraint reduction work group for the tone of my voice and language as I was discussing racial disparities and the use of seclusion and restraint at HCMC. I said it passionately, in a brave space, right? And I was singled out for an investigation where they pulled aside all of the workers. Stewards are not present, right? And I ended up, my first time in an investigation, I got a written reprimand for tone and language when there are serious disparities and also, quite frankly, lack of resources, support, training within the department that ought to have been addressed. Rather than my tone, they should have addressed the problem, right? And that didn't happen in my case. And I've seen it repeated over and over again.
Thank you for sharing, Nathan. Thank you. All right. Again, we appreciate y'all for coming out. We'll keep you abreast of other issues and other actions, rather, that we take. So thank you so much for being here.